Hi everyone, we are going to talk about our geriatric patients' values and how we can effectively work with our geriatric population. So the primary value of self-respect will often be more consciously prized for older people because they perceive that they are subject to loss of self-respect in the ageist society. So let's think about that. They would love to be respected, right? And they often are not. We already talked about this idea of societal bias, right? Of ageism. And so they value that self-respect. Security, they value security. They want to be financially and physically safe, right? It's also a very important factor or value for our elderly population. And then one of the ones that I find the most important is independent functioning. It's valued dearly when transitions to nursing homes is kind of a threat, and some families often threaten their elderly family members with, "We're going to send you to a home," and it shouldn't be that way, right? We want to keep our geriatric population as independently functioning as we can, right? So that they can perform these activities for as long as they can in as much capacity as they can. So not just, go ahead and rushing them through getting dressed, making sure they're safe, but allowing them to get dressed themselves. Keeping that functioning up is so important. And then listening for what the values are of these patients. So listening for which values the older patient expresses, and then trying to set treatment goals according to those values, and it'll really enhance your success. Perhaps the individual just wants to be able to do their morning routine on their own, right? And maybe they've had some setbacks, but they can work with physical therapy and occupational therapy and get hopefully back to that point. There obviously is going to be some decline in independent functioning as we age, but we need to try and let them do and set goals that are attainable. So continuing on with our discussion of treating these values that these patients have with respect, let's also talk about just some general ideas that we can use when working with the geriatric patient. So of course there's going to be challenges when caring for the health needs of this population group, but it's important to address these challenges, and it's important to remember to allow patients time to ventilate and express their concerns. So they may have a lot to say, right? And it may take a little time for them to get out what they want to say. But it's important for us to listen and to not rush them through their thoughts or to belittle their concerns, right? Allow for private and confidential discussion. Just because they're an elderly patient does not mean that they don't reserve respect and privacy just like anyone else. Empathize with the situation by showing awareness of the feelings, emotions, and behaviors. They have feelings too. They feel disrespected and unheard, and so it's important to give them the time of day to express these feelings. They get upset and, can have bad days and good days, and so again, just treating them as the individual and not falling into those habits of having stereotyping and biases. Don't talk to older adults as if they were children. Some people really struggle with this and have a hard time with not doing baby talk and, treating them like children. And this is really important to not do. Speak slowly and clearly. Some older individuals do have difficulty hearing, and they may need to read your lips. So make sure to speak slowly and clearly, and especially if you pick up that they may have some difficulty, not just brushing it off and just go on about your business, but really try and make sure that you are communicating clearly with the individual. Face the individual while talking. That goes with reading lips. This is really important. And I've noticed with the pandemic going on, our older population is really struggling because a lot of them rely on reading lips, and with our masks covering our faces, it really becomes a barrier. So it's even more important for us to hone in on this and to realize it's a barrier and to speak more clearly give them opportunities to ask questions, and really make sure that they are understanding us. And this goes into the next point, which is writing instructions. So not just verbal communication, but written communication is very important for this population because it serves as a reminder. They may forget certain details that you tell them, and it's important to have both verbal and written instructions and information. So as you're thinking through this population and thinking through how you're going to interact with these individuals, just remember that they're all individuals. They all have different experiences and different attitudes and beliefs and feelings, and take each one and try and care for them each individually and do the best you can.